Hi, I'm Dr. Cris Barkmeier, chiropractor and certified active release technique provider. Today we're going to talk about iliotibial band syndrome, or ITB syndrome for short. ITB syndrome is a common overuse type injury found in runners, cyclists, and hikers. And it's commonly seen in runners who rapidly increase their mileage and maybe also have some gait abnormalities such as overpronation. Now, causes of iliotibial band syndrome are running on uneven surfaces such as an indoor track or perhaps the shoulder of a road, a rapid increase in mileage like we said before, downhill running. There could be some anatomical problems such as high or low arches. You could be bow-legged. Also, muscular imbalances seem to contribute to it as well. Weak abductors and stabilizers of the hip, and weak low back muscles as well. Really anything that causes the iliotibial band to become tight, and as you're running or hiking, cycling, and it just gets more ropey, and it over that lateral condyle just keeps on clicking back and forth, and anything that does that kind of stuff. Iliotibial band, what does it do? Well, the iliotibial band is a fascial continuation of the tensor fasciae latae muscle. Tensor fasciae latae muscle begins around this region of the hip. It comes down right around the trochanter of the femur, becomes more fascial at this point, and then the gluteus maximus muscle also attaches into it, becomes more bandy down through this area, and attaches right down here onto the tibia. Now, the function of the iliotibial band is basically to stabilize the knee, especially when it's an extension. Now, we can assess whether a person has iliotibial band syndrome or not pretty easily, actually. We can usually tell by the history of the chief complaint and the location of the patient's symptoms whether they have it or not. So really what we're checking to do is to see the extent of the injury. Now, a patient will come in and they'll say, I have clicking and locking of the knee, pain and tenderness around the lateral portion of the knee, especially on heel strike, and that usually gives it away. And they'll notice it when they increase their intensity or increase the distance, or both. So really what we try to do is assess the extent of the injury. Now, for instance, we'll look at the vastus lateralis because it's the most lateral portion of your quad, 4 muscles here, and that come together to make your quad. We'll check it to see if it's moving, sliding properly, because a lot of times it isn't, so we'll start with that one. Then also we'll check the lateral meniscus, because a lot of times it'll get fixated or malpositioned. We'll also check the popliteus muscle, because if the meniscus is messed up, then most likely the popliteus is as well. It's a rotary stabilization muscle, and it has fascial connections to everything in there as well. And I'll also check the fibular head, and I'll check the gastroc muscle as well. Now, traditional treatments are rest, ice, compression, elevation, RICE. And then, you'll also do massage therapy and foam roller treatment. How does active release technique help with iliotibial band syndrome, and how is it better than traditional therapies such as RICE, rest, ice, compress, elevate, massage therapy, and foam rolling? Well, first of all, it's going to break up the scar tissue, and not in the manner that a massage therapist would break it up just kind of randomly. We're going to look for specific spots in the tissue to break up that scar tissue. Second, we're going to lengthen the muscle, and when I say that, we're going to break up the scar tissue. At the same time, we're going to take it from the short to long position, which ultimately lengthens the muscle. Next, we're going to lay down the fibers with the orientation of the muscle to make sure it ensures proper healing. Who uses ART? Well, first of all, and foremost, it's for anyone. It doesn't have a certain person that can use it over anyone else, but it is the official soft tissue treatment of the Ironman triathlon, so that tells you something about it right away. Now, the NFL uses it, the NBA uses it, pro golfers use it, the UFC, Ultimate Fighting Championships, and mixed martial artists, they also use it. Runners, marathon runners, hiking, cyclists, it's for everybody, really. If you're a person that sits behind a desk, it's for you as well. So don't get alarmed and think that, oh, it's only for professional athletes, because that's not the case. It is for everyone.